So, Stephen, this is what you're going to do every day for 3 weeks. And then you're going to do it twice a week for 3 weeks.
Mm-hmm.
Then you're going to do it once a week for 2 months. Okay?
Okay.
And this will keep your atlas in a neutral position. Okay?
Okay.
It would take a large passive force to undo it. You're not going to overdo the correction. It would take another injury to make it get stuck in flexion, is what I'm saying.
Yes.
Okay? So you put a pillow under your head, and that puts your neck in about 10 degrees of flexion.
Mm-hmm.
Okay?
Okay.
And then you tuck your chin. Beautiful. And then you glide your head backwards. Good. And then with your open hand on your mandible, maxilla, on your maxilla, you gently push. Just take up the movement that's available, and you're pushing towards the ear. And you just stay there, and 2 minutes is plenty. And that's how you restore flexion to the atlas on the axis. Now keep the position there. We'll pretend 2 minutes went by. Then you take your hand off the maxilla, and then you do traction. So you're still tucked, you're still glided backwards. Put both hands on the head, on the temples, and then just push up towards the crown of the head. Good. Very gentle. And you do that for 2 minutes. Okay?
Okay.
And then while you're lying here on your back, go ahead and put your hands down. I'm going to take the pillow out. And you can roll up a towel, or if you want one of these, you have this foam, don't you?
Mm-hmm. Yes.
You have it, good. So you put the foam under your neck now. So you get a little bit of arch backwards, and that automatically forces the jaw to open up. If it doesn't, then just separate your teeth a little bit.
Mm-hmm.
And then relax. And then with your hands, you're going to contact this part of your mandible, and ever so gently you're going to pull it downward. And I want you to do this for 2 minutes twice a week, forever. Okay? Go ahead and put your hands and replicate that. It's a very small force. Okay?
Okay.
Good, thank you. You can step down. Now, the atlas also has a lot of rotation. It has at least 35 degrees of right rotation and of left rotation, and maybe even more.
Mm-hmm.
Okay? It has very little side glide. Okay? And very little side bending. If you restore the rotation, those other two motions should follow along. Mm-hmm. But nonetheless, I'll show you how to isolate those. So this exercise you want to do once a day, just like the others. Okay? The same sequence. All right? And what you do is you tuck your chin, and then all the other facet joints are fully flexed, and the capsules are tight, and this isolates movement of C1. So, chin on your chest, and then you rotate to the right as far as you can go. And then you do side bending ear to shoulder. It's a real small movement. And do 10 of those. And then try side glide. I'm side gliding, but it's so subtle. I don't know if the camera can pick it up. But do you understand? I'm just going side to side. Okay? So I'm still rotated. I'm still tucked in the chin. And I'm going side to side. 10 times. And then I just stretch in rotation. Now I just add a little tiny bit of rotation. Very, very gentle. Okay?
Mm-hmm.
If it's uncomfortable, then go the other direction. Okay? But if you're doing okay, you want to do it in both directions. So then you want to do chin to chest, rotate to the left, side bend, left and right, 10 times. Then you want to do a glide, left and right glide, and then just pure rotation, end range stretch. Okay?
Mm-hmm.
Good. But always keep your chin down, chin to your chest. Okay, I'm going to lay on the table now with my head off that end. To build strength in your neck, you want to lay off your bed, tuck your chin, glide back, and glide forward.
It's the longest call lie.
Yes, sir. And do 10, but build up to 30. And after 30 is easy, then hold it for 5 seconds. All right?
Mm-hmm.
And then you're going to do the same thing. Lean on your side. You're going to rotate your head, looking as far as you can to the left, and then rotate to the right. Same drill. Okay?
Mm-hmm.
And then you're going to do side bending. Okay?
Mm-hmm.
Then do it on the other side. And then bend your neck all the way. Tuck your chin slightly and then extend. Okay?
Yep.
And that's what I recommend for strengthening and for keeping the motion up there.
Great.
Thank you.